Welcome back to our 5 Nursing Tutorial YouTube channel. In this class, we are going to discuss with another new topic, that is disorders of menstrual cycle. We'll study in detail. First, we'll see the important one-liners, that is about the menstrual cycle. These are the normal parameters. Here, we can see normal length of menstrual cycle, that is 21 to 35 days. And then average length is 28 days. And then number of days of bleeding is 2 to 7 days, and the average days of bleeding is 4 to 6 days, and then normal blood loss, that will be 5 to 80 ml, and then average blood loss is 35 ml to 50 ml. These are some of the normal parameters that is about the menstrual cycle. Next, we will discuss regarding the disorders comes under menstrual cycle. First one we will discuss, that is with amenorrhea. Here, amenorrhea is nothing but there will be the absence of menstruation. There will be the absence of menstruation. And then here in amenorrhea there are two types. One is physiological, one is pathological. Physiological is a normal one. That is before puberty there will not get menstruation, and then before puberty and then pregnancy, because the hormone level, that is estrogen and the progesterone level will be high. That is in the pregnancy. And then breastfeeding, here prolactin level increased. That's what it inhibits GnRH hormone, gonadotropin releasing hormone. And then after menopause. This is what about physiological. Next we will see the pathological. And here in pathological amenorrhea also there are two types. One is primary amenorrhea, another one is the secondary amenorrhea. What happens in the primary? That is, female has never menstruated and then not attained menarche. This is about primary amenorrhea. And then next we will see the secondary. Secondary amenorrhea is nothing but it means earlier female was menstruating, but now there is no menstruation due to the cause. These are the causes. That is, it may be hypothyroidism or severe anemia or PCOD, that is polycystic ovarian disorder, and then excessive stress, and then increased prolactin level, and then Asherman syndrome. Asherman syndrome is nothing but there will be the scar tissue, we can say, on the uterus. In the uterus, scar tissue will be present. That is Asherman syndrome. This is all what about amenorrhea. Next, we will see regarding dismenorrhea. Dismenorrhea is nothing but there will be the moderate to severe pain during menstruation. And then here also there are two types. One is primary and one is the secondary. First we will see about primary. Here there is no reason of pain, and then commonly seen in young female. Here pain is centralized or just above, that is suprapubic, and then it starts 1 to 2 days before menstruation. 1 to 2 days before menstruation, and then subside onset of menstruation. That is decrease the beginning of the menstruation, and then it is also called as spasmodic dysmenorrhea. Spasmodic dysmenorrhea, and then treatment is can take NSAIDs, that is a non-steroidal anti-inflammatory drugs, and then that is oral contraceptive pills. And then next we will see about the secondary dysmenorrhea. Secondary dysmenorrhea. Here there is some pelvic pathology causing pain, and then most common cause, that is endometriosis, and then fibroid, and then PID, that is pelvic inflammatory disorders. And then here most commonly seen in reproductive age. And then here pain is localized. In primary it is centralized, and then here pain that is in the localized, and then starts 4 to 7 days before menstruation. 4 to 7 days before menstruation, and then it is not relieved with menstruation. And then here it is also called as secondary dysmenorrhea, is also called as a congestive dysmenorrhea. And then treatment is can treat the cause. This is all about dysmenorrhea. Next we will see another disorder comes under menstrual cycle, that is menorrhea. Here menorrhea, that is excessive bleeding, that is more than 80 ml. more than 80 ml of bleeding, and the number of days of bleeding more than 8 days, more than 8 days, and then seen in the fibroid uterus. We can see this menorrhagia in the fibroid uterus. And then next disorder is hypomenorrhea. Hypomenorrhea, here hypo, this one is opposite, that is less bleeding. Less bleeding, that is bleeding less than 5 ml. Bleeding less than 5 ml. And then number of days of bleeding less than 2 days. 2 days. And then seen in Asherman syndrome. Asherman syndrome is nothing but there is the scar tissue in the uterus. And then next we will see the polymenorrhea. Polymenorrhea, here what happens? Short menstrual cycle, that is frequent menstruation. Frequent menstruation, that is less than 21 days. And then here congested bleeding, ovary we can see, that is under polymenorrhea. Next we will see oligomenorrhea. Here long menstrual cycle and infrequent menstruation takes place. Here frequent menstruation, and then here in oligomenorrhea there is infrequent menstruation. There is a frequent menstruation, and then here more than 35 days. More than 35 days. We can see here less than 21 days. That is in a polymenorrhea, and this is in a oligomenorrhea. And then next we will see another disorder, that is menstrual. Menstrual is nothing but a irregular or intermenstrual bleeding. Irregular bleeding we can see. And then it may occur every few weeks. And then seen in polycystic uterus. Here there is the growth in the lining of the uterus. It can vary in size and number. That is seen in polycystic uterus. And then another disorder comes under menstrual cycle, that is amenorrhea. Amenorrhea is nothing but there will be excessive bleeding, and then we can see that at irregular intervals. That is amenorrhea. Next we will see another disorder, that is cryptomenorrhea. It comes under menstrual cycle. This is also one disorder of menstrual cycle. Here cryptomenorrhea. Here cryptomenorrhia means it's a hidden menstruation. Means menstruation occurs but it is not visible due to the obstruction in the outflow tract. That's what it is, hidden menstruation. And then causes imperforate hymen. This is a congenital problem. Congenital one. And then your diagnosis is patient complaint of pain in abdomen but no menstruation due to the obstruction in the outflow tract. And then local examination, that is tense, bluish, bulging hymen can see. And then complication like blood collect in uterus and vagina. And then treatment, that is give cruciate incision on hymen. This is all what about the disorders in menstrual cycle. Disorders of menstrual cycle. I hope you all are clear with the topic. Please like, share and subscribe to my YouTube channel. Thank you for watching.